Hello and welcome to GenomicMD. Today we're going to introduce you to our new genetic test, the Lifetime Genomics Risk Assessment, or LGRA for short. The LGRA analyzes your DNA to identify the conditions you're at an increased genetic risk for developing, which can then help you and your provider make your health plan more personalized and preventative. Our test does this by using something called polygenic risk scores, often abbreviated as PRS. But what exactly are they? Polygenic risk scores are calculated by analyzing multiple small genetic variations across your DNA. We offer a more comprehensive video on how these work, but in short, imagine we take all of your DNA and we identify you carrying these genetic variants associated with a risk for developing a given condition, like diabetes. Your polygenic risk score would then be the result of an algorithm taking these variants to output a result representing the total impact they have on your risk. So what conditions are included on the test? The LGRA can assess your risk for different cardiovascular diseases, metabolic conditions such as diabetes, common cancers such as breast, prostate, and skin cancer, as well as a few others. We're constantly evaluating new conditions to add, so if you're not seeing something specific on this list, we may be offering it in the future. So, what does a report actually look like? Here you can see a sample report for John Doe, a male in his early 30s. John had the cardiometabolic panel ordered, and so he had his genetic risk assessed for several different conditions, including coronary artery disease and chronic kidney disease. The LGRA will indicate whether his risk for these conditions is increased or average. Here you can see what both of those results look like. If your result is increased, it means that your risk for developing the condition is greater than what is considered average. By how much exactly depends on the condition. In the case of coronary artery disease, it is at least 1.5 times. In other words, based on his polygenic risk score, John's risk for developing coronary artery disease is at least 1.5 times as high as what's considered average in the population. Meanwhile, his risk for type 2 diabetes and the other three conditions is considered typical. A few important notes before we continue. First, an increased risk result only means that your genetic predisposition for developing the condition is higher than average. It does not mean John currently has the disease, nor that he is now guaranteed to develop it in the future. At the same time, an average risk result doesn't mean zero risk. It just means your genetic predisposition is typical. For some common diseases, your risk might still be significant even if it's considered average. And finally, your genetic risk is just one piece of the puzzle. You may be at average genetic risk for type 2 diabetes, but being overweight and physically inactive can still certainly result in the condition developing. With these insights, your healthcare provider can better personalize your health plan. This might include recommending earlier or more frequent screenings, emphasizing certain lifestyle changes, or referring you to specialists for additional interventions. So, what does the testing process look like? The process is simple and convenient. First, your doctor will order the test. Once payment has been received, we will ship a saliva collection kit to your home. You can see here what the kit will look like when it arrives at your doorstep. The kit will come with instructions, but all you will need to do is spit into a tube and ship it back to us via a prepaid mailer included in the kit. Once we have received your sample, your provider can expect to receive your report about 2 to 4 weeks later, after which they will share and review the results with you. Remember, your polygenic risk score is just one piece of the puzzle. Combined with other factors such as lifestyle and family history, it forms your total disease risk. Your healthcare provider will help you make sense of how your polygenic risk scores fit into the broader picture. If you have any questions or still want to learn more, you can take a photo or screenshot of this page. It includes our website, contact information, and a QR code that will take you to our patient resources page. If you're unfamiliar with QR codes, don't worry. You can also just go to bit.ly/GMD info, which will take you to the same page.